This is a 71-year-old male patient who presented with headaches and right-sided weakness. He doesn't remember exactly what happened to him. He doesn't remember if he had a trauma to his head or not, but there might be some collateral history saying that he might have hit his head a month ago. What else do you need to know from the history of this patient? Please let me know in the comments below. The patient was taken to the hospital and imaging has been organized. A CT scan was done, which you can see here. We'll go through that again from all the way from down to up. I'm going to give you 5 seconds as I'm scrolling through the scan so that you can identify what's going on. So what we can see here, we can see that there is a collection on the left side, convexity of the brain, which extends all the way up through the convexity of the brain. And given that shape, it has like a crescent shape. It's not like a biconvex shape like our last case, which was an extradural hematoma. And that basically will make this one as a chronic subdural hematoma. So it's subdural because of the shape, and it's chronic because of the color or the density of this collection on the CT scan, because it's slightly hypodense. If similar to that, but if it has a white bright color, then it would be, but having the same crescent shape, that would be an acute subdural hematoma. But this one is a chronic subdural hematoma. There are other things that we can identify with the scan. What you can see that there is a bit of effacement of the sulci and gyri on that side. If you compare it to the other side, those sulci and gyri are kind of open. But this one, there is an effacement of the sulci and gyri. There are some other radiological features that we can look for, but it's not that obvious here. Some of them are basically looking into if there is a midline shift or if there is a ventricular effacement or not. But if we have a look into this other patient, if we scroll again, the density of the blood here is slightly different. So it's not that obvious like the other one, but you can see that there is a collection here on the right side of the convexity of the brain. Again, what's more obvious here is the amount of midline shift of the brain, the amount of the effacement of the ventricles and the sulci and gyri. So this patient, I would expect that he has more profound neurology, more profound deterioration in his GCS and consciousness level compared to the other patients. Those patients can be treated if symptomatically by either doing a burr hole, which is most commonly done operation, doing 2 burr holes with insertion of a drain, or the other option, some people might do a small craniotomy flap, and most of the patients will do well after this operation, depending on their initial GCS and their initial neurology. Stay tuned for the next video.